right, well, we're going to get started just because I want to make sure we're being cautious of time. But hi, everyone. Welcome. Good afternoon to you all. Thank you so much for joining us today. My name is Priya Raman. My pronouns are she, hers. I am the CAPE 3 program coordinator here at the Asian Pacific Partners for Empowerment, Advocacy, and Leadership, also known as APPEAL. I will be facilitating our Uplifting Cessation Together culturally tailored approaches to support Asian American communities in collaboration with the Asian Smokers Quitline and the TIPS campaign. Just a reminder, as a participant, you are all muted, so please use the chat box to chat with our team and the QA box to drop any questions to our panelists. We will have time at the end of our webinar today to cover questions, so please drop those in the chat. At the end, we will also be asking folks to fill out an evaluation form. So please, if you can stay till the end, please fill that out. Let me go to my next slide. So our objectives for today is during this webinar, participants will be able to increase awareness about commercial tobacco use in Asian American communities, describe existing culturally tailored cessation resources and how to utilize them, and explain what is needed to achieve equitable cessation resources for all Asian American communities. Here are our panelists today. We have Rod Liu from APPEAL. We have Sherry from Asian Smokers Quitline, Renee Nolan Rosencrantz from CDC Office of Smoking and Health, and me as your facilitator today. Just a little bit about our organizations that we work for. So APPEAL is the Asian Pacific Partners for Empowerment, Advocacy, and Leadership. We are a national organization working towards social justice in an equity-centered, healthy, tobacco, and cancer-free community. We work for healthy, equity-centered living for all populations, primarily focusing on the Asian American, Native Hawaiian, and Pacific Islanders, and APPEAL has sustained this national network on commercial tobacco and cancer for nearly 30 years. CAPE 3 is the Center for Asian American, Native Hawaiian, and Pacific Islander Center for Excellence, Equity, and Empowerment, which is the acronym CAPE 3 network. This is a part of APPEAL, the national organization, again, working towards social justice and equity-centered, healthy, tobacco and cancer-free community. We work, again, with the Asian American, Native Hawaiian, Pacific Islander communities, and we are one of the 9 nationally funded networks through the CDC Office of Smoking and Health and Division for Cancer Prevention and Control to advance prevention of commercial tobacco use in cancer populations experiencing tobacco and cancer-related health disparities. Some of the things that we provide at APPEAL include technical assistance and training. So for technical assistance, we talk a lot about information on culturally and linguistically appropriate tobacco education materials, data on AAPI tobacco issues, guidance and input on program-related actions, guidance and input on policy-focused issues, and letters of support. Trainings include tobacco's impact on the AA and NHPI communities, cultural or community competence, leadership development, AA and NHPI, youth mobilization, capacity building, coalition development, and advocacy and policy development. Just some background information about Asian Americans and smoking prevalence. The Asian American community is a diverse community representing over 20 countries, each with their own unique history, cultures, languages, and other characteristics. And just some common stats about smoking prevalence. So smoking prevalence among the Asian American community is noted at 7%, which is actually the lowest across the US population. But when we look at data disaggregation, we see that for each subgroup, there's actually a higher smoking prevalence than what is nationally listed, with Korean community being at 20% and 16.3% among Vietnamese. And now I'm going to pass it over to our first speaker of the day. We're going to pass it to Sherry. Sherry is a seasoned public health professional specializing in partnership development, project management, and community engagement with a focus on tobacco cessation. As the program manager at Asian Smokers Quitline, Sherry is dedicated to raising awareness about the harmful effects of commercial tobacco use and implementing effective strategies about the harmful effects of commercial tobacco use and implementing effective strategies to promote culturally tailored cessation resources to diverse communities. Her passion lies in achieving positive health outcomes through collaborative and community-driven approaches. So I'm going to pass the floor to Sherry.
Hello, everyone. Good morning or good afternoon. And I'm very excited that we have this opportunity to share the insights about the collaborative efforts at ASQ alongside with Appeal, CDC, local and state health departments, community groups, and so many other people all this year to support ASQ and also to support our Asian American communities in their journey to quit smoking or to become smoke-free. Next slide. So before we talk about all these collaborative efforts, I would like to share some important statistics with all of you. As you can see, the Asian American men, they do have a higher smoking prevalence, with 1 in 7 individuals smoking cigarettes. And you can see that the foreign-born Asians also exhibit higher smoking rates, particularly with Korean, Vietnamese, and Chinese Americans. Next slide. And many Asian Americans also face language barriers. And the Chinese, Korean, and Vietnamese, they have such a high, limited English proficient rate among all the second language populations in the United States. And the research also indicates that the LEP, the limited language skills and the low literacy skills are associated with lower educational attainment and the worst health outcomes. And because of that, providing additional support to the limited English proficient LEP populations is very important, especially those within the Asian cultural context when English is not their first language. Next slide. Therefore, at ASQ, we are provided essentials services that is funded by CDC since 2012. And we offer the free telephone counseling to people who speak in Chinese, Korean, and Vietnamese in the United States. And besides the in-language telephone counselings, we also have the materials in the written materials. They are in different languages as well, in Chinese, Korean, and Vietnamese. And besides that, we also understand that nowadays people, they might want to get more information through their phone. So we also have texting programs to help those who would like to get some quitting message or the quit support messages along the way. So we do have that services, and all of these services are free. For those eligible smokers, we also send them 2-week supply of the nicotine patches directly to their home. For your reference, our operating hours is Monday through Friday, 7 a.m. to 9 p.m. Pacific time. And next slide. And you can see that for people to join the ASQ or to enroll into our services, there are 2 options for them. They can either do it through phone, and for each language, we do have a language dedicated lines to help the clients to connect with the agents to speak that language immediately. They do not need to jump through so many hoops. So it's a live agent if they call during those operations hours. Usually it takes about 9 minutes to complete the entire intake, and it's also depending on each client's situations. So 9 minutes, it's just more like average number for it. And during those phone enrollments, we will also access, the eligibility to getting that nicotine replacement therapy. In our case, we're providing the free nicotine patches. And if possible, we'll try to schedule the coaching call with the clients right on that spot. And we also understand that there are clients, they are living in different time zones or they prefer to do these enrollment on their own pace. So we also have an online intake forms or the online enrollment forms that are available in traditional Chinese, simplified Chinese, Korean, and Vietnamese. So clients, they can fill it out on their own time. And there are questions asking about their smoking habits, or if they are not tobacco users, they can also fill out a form. And for these clients, no matter they are smokers, vapers, or the friends or family members, usually within the 2 business days, our ASQ coach or the agents will reach out to the clients to offer telephone counseling. And for these clients, if they are eligible to receive the NRT, the nicotine patches, we will also do the assessment in that follow-up phone calls. Next slide. So regardless of which method that they are joining ASQ, they would receive these self-help booklets either through email, or they can choose to receive it by physical mail. So we will send it to them and they do not need to pay for anything. Next slide. And also for the proxy clients, they would also get a specific booklet that is helping the friends or family members to know what are the top 10 tips or the advice they can give to their smoking friends or family members to help them to quit smoking. And after the intake or the enrollment, if the clients, they choose to receive the telephone counselings with us, there will be like two portions of it. The first one is the initial call. It usually takes about 20 to 30 minutes. In these very first initial counseling call or the coaching call, the coaches will spend a lot of time to help the clients to figure out these main three areas, their motivations to quit smoking, and help them to figure out what is the plan that will work for them. Every individual is different. So we will spend a lot of time to help them to identify what are the challenging moments, what are the things that they can do, and what kind of coping strategies or mechanisms or things that they need to change so that that makes them easier in these quitting process. And they will also discuss about how to use the quitting aid to make sure that they know how to use it properly. And of course, towards the end, we really wanted to encourage the clients to make the quit attempts. So we will encourage them to set a quit date. And if the clients, they do have a quit date and they like to, continue to receive the follow-up phone calls with our coach, then they can, we will schedule the follow-up phone calls with the clients. Usually, we will schedule up to 4 follow-up phone calls to see how the client is doing. And the purpose of these proactive follow-up calls is to prevent the relapse. And we know that usually during the first week or the first few days of quitting, it's the toughest moment. So we wanted to provide the greatest support during those times. Next slide. And of course, besides providing the free nicotine patches to eligible smokers, starting February 1st, 2024, ASQ have additional special promotion offer, which is a $20 gift cards. Next slide. And for these $20 gift cards, it is not only providing to eligible smokers, for eligible individuals, if they are not smokers, but they are friends or family members, or they are the vapors, they could also qualify to have these $20 gift cards. And these $20 gift cards as an additional promotion or incentive, the ideas for that is we wanted to raise the awareness about the importance of quitting smoking. And we also wanted to encourage individuals to realize that quitting, it's usually takes time to do it. Sometimes it may take multiple attempts to become totally smoke-free. So we wanted to bring this message to the smokers and also to people that will quit before, but they may need additional support along the way. And also we wanted to make sure that the people around them will understand about it so they can get these resources and share it with their friends or family members. Next slide. And to promote these, ASQ services and to increase their utilizations and increase the awareness of the importance of quitting smoking, we developed the social media posts to reach the Asian American communities. And our team has, creating these engaging posts highlighting our services and special offers. For example, the $20 gift cards and the free nicotine patches that we are giving out. And so we encourage all of you to follow our Facebook page, and you can scan these QR code right here, or in just a minute, I'm going to share the Facebook link. Follow us and you can stay up to date about our current, service updates or any, new promotions that is going on. And most importantly, for these posts, after, you join it, you share our ASQ Facebook pages, you can also share that with the groups of the people that you know to help to spread the word and to make sure that for those people that they may not speak English or they speak one of these languages that we offer, they would know there are available resources out there to help them to quit smoking. Next slide. And to help every one of us to strategize our promotional efforts, I put up these informations together to share a little bit more about how, the ASQ clients get to know ASQ. So over the years, we have found that mass media, majority of our clients, they heard about ASQ through like newspaper and radio. These are the major media source that have the advertisement on it. And we also see that friends and family members, healthcare providers, they are also really important referral source from here. And a lot of the times when the clients, they call us, when they share about it, that they heard of us from friends or family members, it's like either the friends or their, family members told them that, hey, this is the number that I've got in a community event, or this is something that I saw at a clinic. Or sometimes the clients will let us know that the doctor actually referred them to the clients to ASQ, or they actually tell them that, hey, call the ASQ to see what kind of help that they can give it to you. And I also wanted to point out the other slide right here, the overall referral source. Even though we didn't say it specifically, but as we have developed our online enrollment form, we do see that there are more and more ASQ clients, they are enrolling to our service through internet. So as we know that the digital resources through the social media or through some digital platforms are also really important to promote the service to our client. Next slide. In this slide, we are sharing some preliminary demographics for our ASQ clients between 2012 and 2022. And in these, as of now, we have served over 20,000 individuals, and majority of them, they are male smokers aged 45 or older. And you can also see other information that to give you ideas about insurance and educations. And so these gives us an idea about who are the people that reaching to the ASQ. And although these informations, they're very rough and they're not finalized the data yet, but it gives us some sort of sense about like who have access to ASQ. And these informations may help us to tailor our outreach approach and also services to better meet their needs to our target populations. And one thing that I wanted to point out here, it's about our individuals' languages tables right here, the Chinese, Korean, and Vietnamese. All of them, they are calculated independently within their own group. So it is not meant to compare across the different groups. So because the enrollees for the different languages groups is a little different, and these percentages are actually just calculating within, the Chinese, within the Korean, within the Vietnamese. So they are not comparing one to the other one. So they are just using it independently. So this is one of the things that I wanted to point out here. Next slide, I'm going to share with you about some of the collaborations that we have done over the years with the state and local health department. And these are some of the things that in Illinois, New York City, and California that they have been promoting ASQ and to expand, our reach in their local levels through the different events. And some of them, they promote this in summer, during the Lunar New Year, and then also at the end of the years through the different ways, out of home campaign, local newspaper, or through the YouTube channel. Next slide. And these partnerships also go beyond paid media promotions. And we know that health departments, they also connect ASQ with state quitlines, such as the Colorado quitline here, that they have our hyperlink on their site that link out to the ASQ and language web pages, and then the local community groups to created a postcards during special occasions that also features the ASQ numbers to share within their communities. And then we also have the co-branding materials that we have developed that also encourage, the local community groups or other groups to co-brand it together and to share this information in their states. Next slide, please. And besides all these, work, as a result of, these kind of connections, the promotions, we do have community groups reach out to ASQ over the years. And you can see, of course, Appeal is one of the CDC networks that has been our great partners that always, found opportunity to share about the ASQ services. And this one is before pandemic, during one of the Lunar New Year in Oakland, California. They promote ASQ, help us to distribute the Lunar New Year red envelopes to the communities, and then the student union or the student organizations at one of the local universities also reach out to us, and then to get our promotional materials, set up tables in their community events to promote ASQ. And so there are so many different ways that to promote ASQ. And next slide, please. And it's just, the right now the opportunities, there are so many different options besides, doing the pay media through the radio and the TV. If there are, some of the special occasions coming up, like this slide that I'm showing here, some of the key dates that for you as a reference to know what kind of events or occasions, maybe it's a good opportunity for you to share about the ASQ services. Next slide. And we also partner with CDC together. And at CDC, the MCRC website, they do have a lot of free and low cost advertising materials that you can use. I'm sure Renee's will give you a little bit more details in just a minute. So I'm just sharing the slides here. They do have the ASQ informations or the ads that's already translated and ready to use. So feel free to go there and download some of it. Next slide. So what I'm trying to say here is it doesn't matter how big or it's how small is the budget. It's really if you're interested or if you wanted to know about how to promote ASQ or these kind of services to the Asian American community in your state, feel free to reach out to us. And I do actually have a colleague, Anna Carbo. She's the project manager at the communications team of Kiki, California. She is joining the webinar. So if you have any questions, feel free to ask us or drop us your contacts and let us know what is your plan, and then we can work with you together. And she also have a lot of knowledge about how to promote ASQ, how to promote the resources in different levels with the various budgets. Next slide. And finally, I'm just going to put everything together in this table to let you know that what is our services, what ASQ offers, and these are official names of ASQ in the different languages, and there are phone numbers, our websites, and the text messaging services. And if you have any questions, feel free to ask us, and or you drop us your contents, and we can contact with you later. And I'm just going to pass the time back to Priya.
Yeah, thanks, Sherry. Thank you so much for sharing such great, insightful information about Asian Smokers Quitline, especially showing us that data and also just reminding us that those resources are there. Here's your contact info if anybody wants to take a screenshot of that. Next, we have Renee, who is a health communication specialist at the CDC in the Office of Smoking and Health, where she supports the Tips from Former Smokers campaign and provides health communication technical assistance. She facilitates the OSH Media Network, a media and communications community of practice for state tobacco control programs and partners. Renee loves to be of service to the states and partners and to help you navigate the many communication resources that OSH offers, including the TIPS campaign. She's based in Atlanta, Georgia, and is originally from Louisiana. I'm going to pass it to Renee.
Thank you so much, Priya. And I want to say that I'm also joined by Avanti Gobole, and she's a communications fellow working on our team, and she's just been so integral to TIPS and to supporting states and partners over the last year. So she's got a bunch of links that she's going to drop in the chat for y'all. And so it's also awesome to come after Sherry. She certainly teed us up perfectly to talk a little bit more about TIPS and MCRC. So let's get started. So next slide, please. So here's what we're going to go over today. So first, I'm going to give just like a brief overview of the TIPS campaign, since there may be some folks on the call who this is new for. And then we're going to highlight the campaign's work to reach diverse communities, specifically Asian American communities. And then we'll talk a little bit about the media placements to reach these groups, and then some of the resources that we have. Next slide. So about TIPS, big picture. In 2012, the Centers for Disease Control and Prevention launched the Tips from Former Smokers campaign, or what we call TIPS for short. And over the years, the campaign has featured more than 40 people who have bravely shared their stories of how tobacco use impacted their lives and the lives of their loved ones. Next slide. TIPS is a comprehensive communications campaign that includes paid media, earned media, social and digital media, and partnerships. The campaign has demonstrated effectiveness in a number of ways, including people attempting to quit and people actually quitting for good. So we've been able to show that from 2012 to 2018, more than 16 million people who smoke attempted to quit, and 1 million people successfully quit because of the campaign. And in 2022, we released a study that showed that the more people who smoked were exposed to TIPS ads, the less likely they were to start smoking again. Or as we like to say, TIPS motivates people to quit and helps them stay quit. Next slide. So really excited to share with you some new features for this year's campaign for 2024, which launched February 5th. So we are currently in the midst of the 2024 campaign. And what's new about our ads this year is that embedded within our traditional health consequences and taking care ads is messaging about the harms of smoking menthol cigarettes and about the tobacco industry's aggressive marketing of cigarettes, especially menthols, to many communities. And the new ads also include 2 new health conditions impacted by smoking, which are peripheral artery disease and kidney cancer. So now let's talk about a little bit about this year's media buy. Next slide. So let's see, actually, I think my slides are swapped. But the campaign continues to advance health equity and address health disparities through its reach, representation, and accessibility of smoking cessation messages. So in addition to our national media buy, which we'll talk about a little bit in a second, the campaign works to reach a broad range of people who smoke. We place additional ads on a variety of media channels to specifically reach the groups shown here on the screen: African American audiences, American Indian or Alaska Native audiences, Asian American, Native Hawaiian, and Pacific Islander audiences, deaf and hard of hearing community, Hispanic and Latino, and LGBTQ+ audiences. And these additional placements include TV programming, print, radio, social, and digital. Next slide, please. And so now here's a little bit about what that national media placement looks like. So as I mentioned, the ads started airing back in February, on February 5th, and they're going to run until September 22nd. And ads are running on national broadcast and cable TV and on digital and social media channels. And new this year, because people's media consumption behavior is changing, we've also placed ads on streaming video properties like Hulu, Paramount Plus, NBC's Peacock, and Fox's Tubi channels. We are running 7 nicotine replacement therapy promotions on TV. So you heard a little bit from Sherry about promoting nicotine replacement therapy. So during the TIPS campaign for select weeks throughout the year, we run our national television ads with a promotion specifically for free nicotine replacement therapy. And so in addition to this national buy, we also, national television, we place some local television in areas with high smoking prevalence, statewide, West Virginia, Kentucky, and Arkansas, as well as local television in Guam. And we also use social media with key audiences to promote quit smoking resources. Next slide. So now I'll share a little bit more about our media placement specifically to reach Asian American audiences, which is why we're here today. So TIPS reaches these communities through in-language national digital properties, complemented by local placements in print and radio. So these particular placements began running on March 25th, and that's because we coordinate these national placements, the timing for them, around ASQ, so Sherry's paid placement, and the state of California's placement. So we want to make sure that we are coordinated in our timing. We work very closely with Sherry and with California folks. Digital media placements, we place in-language digital video and static banner ads. We place Taglish and English language digital media specifically for Filipino audiences. And our digital placements, I should say, are in Korean, Mandarin, Cantonese, and Vietnamese. For print, we place print ads in Mandarin, Cantonese, Korean, and Vietnamese publications in select markets across the states. with high numbers of these audiences, so including such states as California, New Jersey, New York, Pennsylvania, and Texas, and in such cities as in Atlanta, Chicago, and Washington, D.C. For radio, we have radio ads in Cantonese and Mandarin, Korean and Vietnamese as well in local markets, specifically in California and Texas. And since you just heard from Sherry, all our in-language digital and print ads direct people to the Asian Smokers Quitline in the appropriate corresponding language. Our English language digital ads that reach Filipino audiences promote cdc.gov/quit. The next slide, please. So now we'd like to tell you a little bit about Rico. So he's one of the people featured in the campaign. And as we just talked about, the TIPS campaign features real people impacted by the serious long-term health effects due to smoking cigarettes and secondhand smoke exposure. And each real story represents thousands of Americans suffering from similar conditions, right? So Rico, let's talk a little bit about his story, his moving, inspirational story. So he is 48 years old, lives in California. He's a Filipino heritage. He started smoking at age 14. He continued smoking into adulthood because most of his friends smoked and cigarettes were always available. And then at age 45, he got diagnosed with cancer. He became depressed after his diagnosis and treatment. And he focused on personal and professional development to help with his depression. And one of his proudest accomplishments is his commitment to quit smoking and to stay quit. And he quit because he wanted to be around to watch his children grow up. So Rico's stories focus on that theme of family, quitting for one's family, and his print ads are available on the TIPS website and are translated into several languages, including Mandarin, Cantonese, Vietnamese, and Korean. And Avanti's been dropping links in the chat, so we'll also make sure to share these after with Priya afterwards, so you guys can make sure to have access to them. So next slide, please. So in addition to Rico's story, we also reach Asian American audiences through more than 30 translated ads across print, radio, digital, and digital display and digital video. So we've translated the ads of the stories of other people featured in the campaign into Mandarin, Cantonese, Korean, and Vietnamese, Filipino English, and Taglish. So the translated ads feature the stories of 17 people total. So there, in addition to Rico's story, there are other stories that are translated in language and that may resonate with Asian American audiences. So some of the ads that have been translated highlight the smoking-related conditions of lung cancer and heart disease, and also have the theme of caregiving. That's another story theme that we've translated, and it highlights the caregiving theme ads highlight the experiences of family members who take care of a loved one living with a smoking-related disease. Caring for a loved one can affect the caregiver's life in many ways, including their ability to work and maintain good physical and mental health. And this theme we find resonates with many audiences. And also this year, we had a new ad from a man named John B. And his new ad was about quitting and how to quit using medication and counseling prescribed by his doctor. And so we also translated that, and we've been, that's his ad there in the middle on the screen, and we've translated that. And I'll just pause and say, I'm going to say in a minute, but all this is available in the Media Campaign Resource Center. Next slide, please. Perfect tee up from Sherry. The TIPS campaign also does paid and organic social media to reach Asian American audiences, and the timing with which we do that align with the observances that she talked about earlier. So such as Lunar New Year, Asian American Pacific Islander Heritage Month, which is what we're celebrating right now, Mid-Autumn Festival, and North American Chinatown Smoke Free Day. And new this year, we added content for cherry blossom season. So all of this is available in MCRC. All of our social media is available in MCRC, which we'll talk about more in a minute. Next slide. So In addition to the translated ads, we have other resources and tools available. So Rico's biography, so his story on our webpage, and his print ads are available on the website in the languages we've talked about today. We also have a webpage that talks specifically about tobacco use among Asian American people that you might find useful as you craft some of your partner communications. So you're welcome to syndicate that content on your website or use it in your newsletters or what have you. So that's a helpful resource. And then the campaign broadly has a set of resources available, including social media, videos, photos, and MAT articles. And we recently translated the MAT articles into the languages that ASQ provides services in. And they're not yet up on our website, but we're excited to get them there very soon, and we can share them as a follow-up to today's webinar. And beyond tips, as Sherry mentioned, MCRC has a variety of other in-language media assets, including social media images, and Avanti's going to drop some of those links in. So as we translate more materials or have more in-language materials available through the campaign, it is our duty to get those put into MCRC for you to use free of charge. So if you're going to do paid placement, you might have to pay for that placement, but to use the ads themselves is free of charge through the Media Campaign Resource Center. So we really hope that you, feel like you can register for an account, make sure you have account, have an MCRC account, and use these resources in your work to promote the Asian Smokers Quitline. And next slide, and I think that might be it. So happy to answer questions and pass it back to you, Priya. Thanks.
Thank you so much. I'm gonna stop my screen share. All right. So thanks, Renee, for sharing the amazing information about the TIPS campaign. And thanks so much for sharing those resources that people can access. Our next presenter, but not last, is Rod Liu, the founder and executive director of Appeal, the Asian Pacific Partners for Empowerment Advocacy and Leadership. Rod was the health education director at Asian Health Services and the associate director for the Association of Asian Pacific Community Health Organizations. Rod was a contributing author to the 1998 Surgeon General's report on tobacco use and has published widely on commercial tobacco and health disparities. Rod has served on numerous national health advisory committees and received the Christopher Jenkins Cancer Control Award in 2002 and the Lester Breslow Lifetime Achievement Award from his alma mater at UCLA School of Public Health. I'll pass it to you, Rod.
Thank you, Priya. I didn't know you were going to do that long intro, but appreciate that. First of all, just thank you to Cherry and Renee for the wonderful presentations from Asian Smokers Quitline and the CDC TIPS campaign. It's great to be able to have an update, if you will, on the last 10 years, a reflection of the impact that both campaigns have had on addressing commercial tobacco cessation in our diverse Asian American and Native Hawaiian and Pacific Islander communities. Cherry mentioned that there were a number of dates that were significant for the communities. I also just wanted to let people know that we launched our inaugural Breathe Free Day on May 1st this year to coincide with Asian Pacific Heritage Month, the recognition that breathing and breathe health and commercial tobacco control are important elements for sustaining and preserving the heritage of our communities, both Asian American, Native Hawaiian, and Pacific Islander. You may have noticed that a lot of the pieces were focused on Asian American. We wanted to be very transparent that this was focused on Asian American and that we will have other webinars focused on the Native Hawaiian and Pacific Islander communities. So rather than just mentioning that in the name, we wanted to be very clear that these were two different approaches that are needed for those two large racial groups. Just a couple of comments, and I'll make this really quick. Three very quick things. First is, I think both Cherry and Renee highlighted the real importance of partnerships and how vital partnerships are in the work that we do around public health. And clearly, we've all worked with each other, and ASQ and CDC have worked closely together. But I think what they both outlined in terms of the partnerships were really vital. And oftentimes, as Cherry was presenting around Asian Smokers Quitline, we may take it for granted that Asian Smokers Quitline has always been there and will always be there. But it's only been the last several years that the Asian Smokers Quitline was made available to residents outside of California. And just want to thank Centers for Disease Control and Prevention for supporting that effort and the importance of being able to continue that service for the language access around Cantonese, Mandarin, Korean, and Vietnamese community members. Cherry also kind of talked about a lot of the services they offer, how they go through their process of coaching those who are smokers or proxy calls, and then the importance of kind of the media campaign, part of that. So we really appreciate the historic work that Asian Smokers Quitline has provided within this whole context around cessation for many, many years, and if that, and not decades. And then for Renee, talking a little bit about CDC Tips campaign, I think it was really important to highlight somebody that we feel very proud of, and that is Rico Foz, who was the person who was involved in the campaign, the video campaign, and his story, and how it was really important for him to do that for himself and for his family. And those are the kinds of stories that are really important for us to be able to get out there. A lot of times when we have campaigns, we don't often see the faces of our own community members. So having Rico Foz as a big part of a campaign and a continual part of the campaign is really critical. And I encourage any of you that may have individuals that have been impacted by commercial tobacco use to please share those stories so that we can get those out. And that is part of what we're hoping to do with the Breathe Free Day and Breathe Free Month on the month of May, is being able to also share other vignettes of those impacted by commercial tobacco control within both the Asian American and Native Hawaiian and Pacific Islander communities. I think what also Renee shared too was a very diverse media campaign and plan that recognizes that communities are very diverse when we're talking about Asian Americans. And so reaching different communities in different cities and regions requires very different efforts. And so their ability to kind of take input from us and other places and be able to create that into a very targeted campaign to particularly counter tobacco industry targeting has been really vital. And just really want to thank CDC and CDC Tips for their partnership around that. The second piece is obviously one size doesn't fit all. Again, as I mentioned, this is focused more on Asian American and not on Native Hawaiian Pacific Islanders, which we hope to have some webinars in the future. And two key pieces related to that tailoring is that, first of all, we have to have good data. And so data equity and having disaggregated data on tobacco use and vaping is really important. Renee also mentioned the importance of menthol, and there are communities within Asian Americans that have high use of menthol cigarettes. And so any policy issues related to menthol regulation and menthol bans will also positively impact our communities. So just recognizing that there are certain communities, particularly Southeast Asian communities, that have a high use of menthol. And then the other piece is, while Cherry talked a little bit about the importance of language and language access for Quitline, there is really this underscoring piece around that it is both language and culture for us. And it's about understanding communities and understanding where communities come from, understanding the makeup of communities, as she has shown, that it's really important to not only linguistically tailor, but culturally tailor our cessation approaches to be able to effectively reach all of our community. And finally, the third point is really what we would describe as equity and cessation. This past September, we convened 6 advocates from across the country, from 6 different priority populations, to really talk about what does equity and cessation mean. And while it does mean things like quitlines and modalities, and it also is a focus on how you communicate that out, health comms and social media campaigns, it's also about changing the infrastructure so our communities have better access to cessation services. So you'll start hearing us talk a little bit more about building a supportive and positive infrastructure for Asian American communities to be able to access cessation, to be able to understand the impact that commercial tobacco in the industry has had on our community. And we continue to kind of work on those pieces to kind of uplift that equity and cessation piece. While it's important to recognize that the quitlines can reach a certain number of folks, we also recognize that with new generations, developing, we also have to find ways to reach other generations and more recent generations. And we'll continue to work to see how we can build quitline capacity to address those communities, or whatever technology is necessary to get them to go to cessation resources and cessation quitting. So I'm going to end there and just saying again, thank you again to both Cherry and Renee and Asian Smokers Quitline and CDC for their long-term partnership. We continue to hope to work together to improve how we reach our communities and be able to uplift the successes that they both shared with you today. So thank you for joining our webinar today. Back to you, Priya.
Thanks, Rod. Thanks for that great recap of everybody's presentations and for noting how we set up this webinar. So I'm going to ask all of our presenters to come back on camera so we can do a quick Q&A. And folks, if you have questions, feel free to drop them in the chat so we can also monitor those and also have our team kind of track that. But I will start us off. The first question I had is, we talked a lot about paid media during this event today, especially about using paid media during holidays and Heritage Month, especially like right now being AA and NHPI Heritage Month. What are some ways that state health departments and community partners can get involved in uplifting paid media year-round? So I'll let our panelists answer that, and I'll drop it in the chat as well so folks know what we asked. And anybody can kick it off.
Sherry, I want to defer to you if you want to start.
Sure. So for the for example, like the Lunar New Year is actually a pretty significant festivals and occasions for the populations that we are serving. So I would say that for these kind of events, it's always good to develop some of the social media posts that you can share in the these kind of occasions, or in the social media platforms that the people that they're using. Facebook, I would say that majority of our clients, they have access to the Facebook, but for some of the populations, they do have their own specific social media platforms. Say for the Korean cultures, they're using Kakao Talks, or for some of other, Asian cultures, they're using something else. So we are just using Facebook as a way to share some of these, creatives. And then once, you got these images or the messages, you can put it or forward it to the community members or to the groups that are using the different platforms that can also share that kind of messages. And because for the Lunar New Year, usually it's about like family reunion and sharing health, wishing everybody health, living, have a healthy, long life, and these kind of ideas. So this is also a good idea to, encourage them to make a change, because it's a new year. You have your, New Year resolutions to make a change, become a new you, and quit smoking, become a healthier, be around with your grandkids, next generations for a longer time. So these could be something that the messages that they can use. for like low cost of the media, or even it's a free media. And then for the paid media, likewise, we do work with some of the local radio stations that they also wanted to bring some sort of the new hope to their communities. So we work together to develop some of the DJ read scripts. That's also around that idea, wishing them have a happy new year and also wishing them to live in a healthier life. So think about to make a quit time during this time to become a new you. So these kind of things. And we also have press releases from time to time. And those are some of the things that you can repost or reshare with your local media groups. So these are some of the things that we have just done in the past few months.
That is so
So
comprehensive. Yeah, it's perfect. This is so perfect. So, you know, like I think one thing that we try to do for those listening is tell you what our plans are, what we're doing, so that you can take it and extend it deeper into the community. So that's one way. You know, it's like hearing, you know, what Sherry's plans are, what the Tips campaign's plans are. It's like, oh, maybe you've identified, well, there's this, you know, smaller community here where I am that's not being reached. So how can I, you know, pull that stuff that they're doing nationally or even state level and bring it down into my community as well? So I think the only thing I would add on to Sherry's like beautiful explanation about ways to leverage paid media would be like, so leverage it, know the landscape, and know where the paid media is and isn't, and so that you can drive it to where it needs to be.
Thank you so much for sharing that, y'all. Our next question we have is for ASQ, for Sherry specifically. Did you coordinate with the state health departments for the Asian Smokers Quitline promotion?
We do currently California Tobacco Prevention Program. They usually will have media campaign to promote Asian Smokers Quitline around November through early February. Sometimes it depends on when is the Lunar New Year day, because the Lunar New Year dates, it's moving dates. But usually that's the time that they would coordinate the promotions with ASQ, and then we will get together, and then sometimes they will share some of their messages with us and to let us know what are their media campaign schedules is like. And then I also work with New York City health departments, because they have some projects that, or some money that they wanted to promote the Asian Smokers Quitline specifically to the Chinese population, because they do have such a very high smoking prevalence among the male smokers in New York City. So they do have some focused media campaign that is going on. Usually that would happen sometime in the summertime, and their campaigns, it's out of home, TV, radios, newspaper, and I do believe that they also do the digital advertising. So these are the two major ones that's going on. And then of course, you know, we are also working with some other state health departments all year long to figure out what are the best way for them to reach out to their populations. It's also depending on the sizes of certain language. And in the past year, we worked with the Hawaii Department of the Hawaii Department of the Department of Health in Hawaii. So they wanted to reach out to the healthcare providers. They wanted to encourage their nurse to talk more about quitting smoking to the people that are speaking in one of these languages. So we work with them together to develop some sort of ads creative that they can put it on journal articles or put it on magazines that's targeted to the nurse and also to the healthcare professionals. When they see it, they know how to make the referrals from our web portal, or what kind of information that they can give it to their patients, and then their patients can call the Asian Smokers Quitline. So these are the three main ones that is currently going on that we're working with, and here and there we'll get some of the requests or email or contacts from the different states.
Yeah, thanks for sharing, Sherry. Our next question is for back to Renee. What is the Media Campaign Resource Center, and how can people find in-language resources there?
Thank you for asking. What a great question. Um, so it's an online website, basically an online catalog of media materials. It's been around for about 25 years, and it is a wonderful resource for the community. We CDC puts our materials there, and states and partners also submit their materials. Many thanks to Sherry, they've placed materials over the years. So it's a clearinghouse, if you will, of media assets. So to save you the time and money of creating something new, it can be really expensive and time consuming to do new creative. And so why not, start at the MCRC, see what's available, and see if you can adapt anything in there, for your own needs. Let's say something in there's not perfect, but the concept is right, and it's an inspiration to then go and recreate that concept, in your context. So it's a wonderful resource for you to get to see what others have done, what's worked. And speaking of in language, the website has a filter for language. So you can drill down. There's like over 1,000 ads in MCRC. It can be overwhelming, but there's a series of filters to help you find what you're looking for: audience, theme, and language are a few examples. And within language, there are Korean, Vietnamese, and Chinese languages are there for you to select. And there are 16 or so ads for each language last I checked. So, and we're always trying to add more, and many thanks to Sherry for being such a generous donor.
Thanks, y'all. Rod, how can people get more involved with Appeal and Appeals Network?
Well, I think the first thing is if you're not already an Appeal Network member, to please sign up. You can do that on our website, www.appealforhealth.org. We have many different types of activities going on, and it's interesting that you asked that question, Priya, because in early June, we are going to be convening a national leadership program for Asian Americans, Native Hawaiians, Pacific Islanders. So we will have 25 fellows from across the country representing different communities in different states and jurisdictions participating. And leadership development is something that we invest a lot in over the 30 years that we've existed. So there will be other opportunities if you don't get the chance to participate. But we will also be convening a cancer policy summit on June 7th in Washington, D.C. at the end of that national leadership program. And in that cancer summit, if you happen to be, near Washington, D.C. or on the East Coast, that might be easier for you to come and join us. But it'll be a day focused on trying to address our response to the cancer moonshot. And that will include both diverse kinds of cancers, but also commercial tobacco control will be a big part of that. We have confirmed a speaker from the White House, the director of the White House Initiative for Asian Americans, Native Hawaiians, and Pacific Islanders. And there will be advocates, researchers, and service providers from across the community that will be part of that. But there are many other ways, and you can get involved with social media. We have a number of other kind of program activities. Again, going to our website is probably the best way to access that, or reach out to any of the Appeal staff.
Thanks, Rod. And we'll be dropping those links in the chat as well at the end. And I apologize that the chat has not been showing the links, so we will make sure to get the links out to everybody who joined us today and make sure it's posted somewhere so people can access them later. But this concludes our Q&A. So I'm going to share my screen again. We're going to do this as smoothly as possible. So the last piece we have on our agenda for today is filling out the evaluation. So I'm going to give everybody a couple of minutes to do that. And I'm going to have Jay try to drop the SurveyMonkey link in there. But if you have your phone handy, you can just scan the QR code. I promise it'll only take you about 5 minutes to do it. But we would like to have some evaluation so that we know in the future what are other webinars that you all would like to see, and how this webinar is going to help you moving forward. And this webinar will be posted on our YouTube page and also our website, so you can always access it at any time as well. Yeah, I will try to put it in the chat as well. It lets me copy it. Oops. So I'll give you all a minute to fill out that QR code with the survey. And then that concludes our event for today. So thank you so much for joining us today. It's great to see you all. I hope you all learned a lot today about TIPS and ASQ. I learned a lot about both TIPS, ASQ, and Appeal's larger network when it comes to work with equity and cessation. So feel free to stay connected with us. Rod mentioned these earlier, so just make sure y'all get the contact info for our team specifically. So there's our contact infos. Stay connected with us through appealforhealth.org. And please follow us on social media. If you follow our social media, you'll currently see this backdrop that I'm using on our slides are all relevant to the Breathe Free campaign that Rod mentioned earlier. So you'll see throughout the month of May that any posts that have this background are all affiliated with that specific month-long campaign that we're hosting, and it's all being done on our social media. So especially on Instagram, that's where we've been posting our things. So you'll see there's already one community vignette on there as well for you all to check out. And also our briefing is also on there as well. Yeah, thank you so much for joining us today, everyone. Bye.